Cancer can destroy your erection. What every man needs to know. Let me start with something that most men never expect to hear from their doctor. Cancer can affect your ability to have an erection. And for many men, that reality doesn't become clear until they're already facing treatment, surgery, or recovery. By that point, the conversation often shifts quickly from survival to side effects. But one of the most personal and emotionally complex side effects a man may face is erectile dysfunction. This is Dr. Eva Danial, men's health expert, and today we're going to talk about something that is rarely discussed openly but affects thousands of men every year. When people hear the word cancer, their first thought is survival. Their second thought is treatment. Very few men immediately think about sexual health, intimacy, or their identity as a man. Yet, these aspects of life can be deeply affected by both cancer itself and the treatments used to fight it. An erection is not just a physical response. It's the result of an incredibly complex interaction between the brain, nerves, blood vessels, hormones, and emotional state. When cancer enters the picture, many of these systems can be disrupted. Sometimes the cancer directly affects the organs involved in sexual function. Other times, the treatments used to remove or control the cancer can alter nerves, blood flow, or hormone levels. And in many cases, the psychological impact of a cancer diagnosis can create its own challenges with intimacy and performance. So today, we're going to explore the connection between cancer and erectile dysfunction. We'll look at why it happens, what treatments can affect sexual function, and most importantly, what men can do to protect and recover their sexual health after cancer. Because here's the truth that many men need to hear. Losing your erection after cancer is not the end of your masculinity, and it is not the end of your intimate life. But understanding the risks, the science, and the recovery options is absolutely essential. Let's begin by understanding why erections are so vulnerable during cancer treatment. For an erection to happen, several systems in the body must work perfectly together. Your brain sends signals through the spinal cord to nerves in the pelvis. Those nerves trigger the release of chemicals that relax blood vessels in the penis, allowing blood to flow in and create an erection. At the same time, hormones like testosterone influence libido, desire, and overall sexual response. Cancer can disrupt any of these steps. In some cases, tumors grow near the pelvic nerves responsible for erections. In others, the treatments designed to remove cancer can unintentionally affect these delicate structures. One of the most well-known examples is prostate cancer. The prostate gland sits directly below the bladder and surrounds part of the urethra. On both sides of the prostate are bundles of nerves that control erectile function. These nerves are extremely sensitive and incredibly important. During prostate cancer surgery, known as a prostatectomy, surgeons work carefully to remove the cancer while preserving these nerves whenever possible. However, depending on the size and location of the tumor, those nerves may sometimes be damaged or removed as part of the treatment. When that happens, erections can become weaker, less reliable, or temporarily disappear altogether. For some men, erectile function slowly returns over time as nerves heal. For others, the change may be more permanent. Radiation therapy can also affect erectile function. Radiation is designed to destroy cancer cells, but it can also affect surrounding tissues, including blood vessels that supply the penis. Over time, this may reduce blood flow and make erections more difficult to achieve or maintain. Hormone therapy presents another challenge. Many cancers, especially prostate cancer, rely on hormones like testosterone to grow. To slow or stop the cancer, doctors may prescribe treatments that dramatically lower testosterone levels in the body. While this can be an effective strategy against cancer, testosterone also plays a major role in male sexual desire and erectile function. When testosterone levels drop significantly, many men experience reduced libido, difficulty achieving erections, fatigue, and emotional changes. But cancer doesn't have to directly involve the prostate to affect erections. Cancers of the bladder, colon, rectum, and pelvis can also impact the nerves and blood vessels involved in sexual function. Surgeries in these areas sometimes require delicate procedures near the pelvic floor, where the nerve networks responsible for erections are located. Even chemotherapy, which travels throughout the body to attack rapidly dividing cancer cells, can affect sexual health indirectly. Fatigue, nausea, hormone disruption, and changes in body image can all influence a man's confidence and desire for intimacy. And this brings us to a factor that many men underestimate: the emotional impact of cancer. A cancer diagnosis changes the way a man sees his body. It can introduce fear, uncertainty, and stress that affect every aspect of life, including relationships and sexual identity. Many men begin to question their attractiveness, their masculinity, or their ability to satisfy a partner. Anxiety alone can interfere with sexual performance, even when the physical systems involved are still functioning. This is why erectile dysfunction after cancer is often both a physical and psychological experience. It's not simply about nerves or blood vessels. It's about how a man reconnects with his sense of self after facing a life-changing illness. But here's something extremely important that every man should understand. Erectile dysfunction after cancer is not always permanent. In many cases, the body has an incredible ability to recover. Nerves can heal slowly over months or even years. Blood flow can improve with the right therapies and lifestyle changes. Hormone levels can sometimes be restored or balanced with medical guidance. Modern medicine also offers many treatment options that can help men regain sexual function after cancer. Medications, vacuum devices, injections, and surgical implants have helped countless men rebuild satisfying, intimate lives. However, recovery often requires patience, honest communication with doctors, and a willingness to address both the physical and emotional sides of healing. One of the biggest mistakes men make is suffering in silence. Because sexual health is such a personal topic, many men feel embarrassed bringing it up during medical appointments. They may focus only on surviving cancer and avoid discussing intimacy altogether. But sexual health is an important part of overall well-being. Doctors who specialize in men's health understand that survival and quality of life go hand in hand. Addressing erectile function after cancer is not superficial or selfish. It's part of helping men reclaim their full lives after treatment. Another critical factor is timing. Research shows that early intervention can significantly improve recovery of erectile function after certain cancer treatments. In some cases, doctors recommend penile rehabilitation programs shortly after surgery to help maintain blood flow and nerve responsiveness. These programs may include medications, devices, or exercises designed to keep the erectile tissues healthy while the body heals. Think of it like physical therapy for sexual function. Just as muscles need activity and circulation to recover after injury, the tissues involved in erections benefit from stimulation and blood flow during recovery. Without that stimulation, the tissues can lose elasticity and strength over time. And that's why education is so important. When men understand what's happening in their bodies, they're far more likely to seek help early and pursue treatments that improve their chances of recovery. Unfortunately, misinformation and silence still surround this topic. Some men believe that erectile dysfunction after cancer is inevitable and irreversible. Others feel that discussing sexual health somehow diminishes the seriousness of their cancer journey. But the reality is much more hopeful. With the right medical care, emotional support, and lifestyle adjustments, many men are able to regain satisfying sexual lives after cancer. And in some cases, the experience even strengthens relationships, creating deeper communication and emotional intimacy between partners. Because surviving cancer often reshapes priorities, men who once took their health for granted suddenly become more aware of their bodies, their relationships, and the importance of living fully in the present. Sexual health becomes part of that larger picture of recovery and renewal. But to move toward that recovery, we first need to understand the specific cancers and treatments that most commonly affect erections. And that's exactly what we'll explore next.